Hey there, it's Cherylea from Anatomy for the People. In this video, I'm going to be talking about the popliteal fossa. So the popliteal fossa is a diamond-shaped compartment on the posterior aspect of the knee. It transmits important nerves, arteries, and veins. So aside from the important neurovascular structures that move through this space, it is mostly filled with fat, and this is why you have a rounded elevation of the skin behind the knee when your knee is extended. When your knee is slightly flexed, you should be able to see and feel this diamond-shaped depression behind the knee. However, this depression is a little misleading given the extent and size of the popliteal fossa. So let's start with the boundaries of the popliteal fossa. There are superficial boundaries and also deep. Superficial are made up entirely of muscular tissue, and the deep ones are made up by bony landmarks. Okay, so let's start with the superolateral boundary. So the superolateral boundary is made up of the medial border of biceps femoris. The supromedial boundary is made up by the lateral aspect of semimembranosus. The inferolateral boundary is made up by the medial border of the lateral head of gastrocnemius. And lastly, the inferomedial boundary is made up by the lateral border of the medial head of gastrocnemius. Okay, so these were the superficial boundaries of the popliteal fossa. And I also mentioned before that there are deep boundaries. So for the supromedial boundary, the deep, it will be the medial supracondylar line. And then on the other side, we'll have the lateral supracondylar line. Down on the inferolateral boundary, we will have the soleal line from the tibia. And for the inferomedial, there are no bony landmarks. So it'd be more like an imaginary line at that level. So if we talk about the floor of the popliteal fossa, I won't draw it in because it'll get too messy. The floor is actually separated into three parts. So you'll have superior part, the central part, and the inferior part. So the superior part is actually the popliteal surface of the femur. In the central part of the floor of the popliteal fossa, it will be the posterior aspect of the knee capsule. Then the inferior part of the floor of the popliteal fossa will be the investing popliteus fascia, which overlies popliteus, the muscle. So that's the floor. Forming the roof, which will be the most superficial and posterior layer, will be skin, would be the outermost layer. Then deep to the skin, there will be the popliteal fascia. Okay, so let's move on to the contents of the popliteal fossa. So please keep in mind that this is a general introduction video to the popliteal fossa, so I'm not going to be listing all of the little small branches that are coming off the nerves and the arteries and veins. I can make another video that goes into that if you're interested. Okay, so let's start with the most superficial structures and then we'll move our way down. So the most superficial are the nerves. So that is the first thing that you will see if you remove the skin and subcutaneous tissue when you look into the popliteal fossa. So here we have if you can see my finger there, I'll do a little dot there so you can see what I'm pointing at there. Okay, so this nerve coming in is the sciatic nerve. And the sciatic nerve is going to come in and then branch into two different nerves. So going off laterally, we have the common perineal nerve. And the common perineal nerve is going to follow that superolateral boundary down. It will then go over the lateral head of gastrocnemius here and then leave the popliteal fossa. The nerve will then also turn into the tibial nerve. And so this is the largest nerve that you will find in the popliteal fossa. And the tibial nerve will then descend and move a little bit medial, crossing over the vein and the arteries. As I said, there are small branches that branch off here, some cutaneous nerves that will go to the muscles in the area, but that would be for another video. Then if we look at the next layer down, so deep to the nerves, we have the popliteal vein. So the popliteal vein is obviously draining blood back to the heart, so that's entering in inferiorly and moving its way up. So you can see that it enters in on this inferolateral border, and as it moves up, it moves medially. Not too medially, just a little bit. It drains upwards, draining into the popliteal vein as well. You're going to have a lot of veins that are coming from the knee joint and the surrounding areas. The popliteal artery is the deepest out of all of these structures. So the popliteal artery is going to be coming down. It enters in around the superior medial boundary, comes in, and it moves a little bit laterally. And so we can see that the relationship between the nerve, the artery, and the vein has changed as it is we move from superior to inferior. So if we look at the top, the superior part here, we can see that the nerve is the most lateral and the vein is medial to the nerve, and then also the artery is medial to the vein. Then we can see that as we move down to this inferior portion, we can see that we've had a bit of crossover happening. So now the nerve is the most medial structure, followed by the vein and then the artery. The artery is going to give off lots of branches as well to surrounding muscle tissue and also to supply the knee joint. Obviously, there's going to be some lymphatic vessels in the area. There is one notable lymph node which is going to be sitting around here on the popliteal vein, because at around this point here, I'll put this one in, a little extra one for you. There is an important vein that is going to be draining into the popliteal vein there, and that is the small saphenous vein. So you do have a little lymph node that sits around that junction. Okay, so that's a small saphenous vein then draining into that popliteal vein. And that's a super quick intro into the popliteal fossa. I hope that you've learned something today. See you next time. Bye.